Hello, dear students. This is Dr. Fadi Hannawi, Lecturer of Internal Medicine and Hematology, Faculty of Medicine, Ain Shams University. And in this video, I'm going to show you how to examine the neck veins and distal pulses of the leg. In this section, I'm going to show you how to examine the distal pulses of the leg. But first, as we mentioned before, you have to greet the patient warmly, introduce yourself, and explain the examination to the patient. صباح الخير.
صباح النور.
ازيك؟
تمام الحمد لله.
أنا اسمي دكتور فادي.
أهلا وسهلا.
اسمك إيه؟
سيد محمد.
أهلا يا سيد. تسمح لي أفحص رجليك، أشوف النبض في الرجلين؟
مفيش مشكلة.
شكرا. طيب اتفضل على سرير الكشف.
ماشي.
So examining the distal pulses of the leg consists of mainly two pulses or two arteries that we're going to feel. First is the posterior tibial artery, and it lies between the medial malleolus of the leg and the heel. As we see here, this is the groove where the posterior tibial artery runs into. So by pressing your fingers in this groove just posterior to the medial malleolus like this, you can feel the pulse of the posterior tibial artery. Okay. Also, don't forget to comment on the other side and compare both sides at the same time. Okay, the other pulse of the leg that we're going to examine right now is called the dorsalis pedis artery or dorsalis pedis pulse. And it's felt here just lateral to the extensor hallucis longus tendon. And this is the extensor hallucis longus tendon, just lateral to it, right here. And you put your fingers against the bone called navicular bone. And you start feeling by slight pressure on the artery, like this. Also, don't forget to examine the other side and compare both sides regarding the volume. And don't forget to comment on the rate, rhythm, volume, equality, and special characters, and the condition of the arterial wall. Thank you. In this section, I want to show you how to examine the neck veins. But first, as we mentioned before, you have to greet the patient, introduce yourself, and explain the procedure you're going to perform on the patient. صباح الخير.
صباح النور.
ازيك؟
تمام الحمد لله.
أنا دكتور فادي.
أهلا وسهلا.
اسمك إيه؟
سيد محمد.
أهلا يا سيد. تسمح لي أفحص رقبتك؟
مفيش مشكلة.
طيب شكرا. اتفضل على سرير الكشف. So examining the neck veins means essentially examining the internal jugular venous pulse, which is reflected usually from beneath the sternocleidomastoid muscle. So first, by inspecting the neck of the patient, you have to position the patient in a slightly upwards chest position, like 30 degrees, and then observing the neck. If you can't see the pulsations, you can adjust the back of the patient slightly till you observe the pulsations better. So, by looking at the neck of the patient, we can see first you have to slightly bend the head of the patient away from the side examined, and observing the neck veins here, I can see the external jugular vein. This is not what we're going to examine. We're going to examine the internal jugular vein, which is reflected by pulsations in the sternocleidomastoid itself. But first, we have to discriminate between the venous and the arterial pulse, because the arterial pulse might be more exaggerated and more prominent in the neck, and it might confuse you. So, by pressing at the root of the neck slightly like this, if the pulsations disappear, this is the venous pulse that we're going to examine. But if it didn't disappear, this is the carotid pulse or the arterial pulse that we don't want to examine right now. So, by pressing here, I can see that the pulsations slightly disappear. And another fact you have to know very well is the sternal angle lies above the right atrium by about 4 centimeters. So the venous pulsations that we observe, we have to measure them in centimeters, and then we have to add the 4 centimeters between the sternal angle and the right atrium to detect or to determine exactly the jugular venous pressure. So, observing the pulsations, the highest point of the impulse, of the venous impulse, is the point which we're going to measure above the sternal angle. How to measure this point? We have to grab something that's straight as much as possible, and a measuring tape or ruler. So by holding this straight object from the upmost position where we can see the pulsations and extending towards the chest right there. So here is the sternal angle. I can feel it by my hand. So by positioning the ruler like this, I can measure, this is about 2 centimeters above the sternal angle. By adding another 4 centimeters, this means that the jugular venous pressure is about 6 centimeters above the right atrium, which is normal. Up to 4 centimeters above the sternal angle is considered normal. Thank you. So, my dear students, this is the end of our video. I hope it was helpful to you, and I wish you all the best of luck. Thank you.